Okay, this video is called Chronic Dietary Diseases. If you talk to most doctors, MDs, and you tell them that diet's the most important thing in disease, they'll say, oh, that's not correct. You don't know what you're talking about. And that's because they have not been trained in it. They're not trained in nutrition, epidemiology, toxicology, dental things, and anything that starts with the letter S. You know, stress, sleep, spirituality, if you will, sedentary versus exercise. They just don't know these things. So anyways, so if your doctor thinks diet's not important, or if you just want to get a general understanding, this will be a very quick review of it. First of all, lack of dietary fiber. If you don't have good fiber, fiber feeds the good gut bacteria. You'll have bad gut bacteria. Bad gut bacteria have more of the enzyme glucuronidase. Glucuronidase cleaves glucuronic acid off an estrogenic chemical. So what happens is, normally when the body is high in estrogens, it excretes the estrogens through the liver. It conjugates them with glucuronic acid, makes them more soluble in the bile. The bile is that green stuff excreted out of the liver. And then the estrogen is targeted for defecation to remove it from the body. But if you have the bad gut bacteria with the glucuronidase enzyme, they'll cleave the conjugation, and now the estrogen, once it's unconjugated, will be absorbed back through the intestinal tract into your body. So you'll have persistently elevated estrogen levels, and you become estrogen overloaded. Estrogen overload is associated with proliferation of breast ductal cells, breast cancer in women, endometrial cancer in women. And the male equivalent of the uterus is the prostate. It becomes hypertrophic, can cause BPH, benign prostatic hypertrophy, or prostate cancer. And then we used to joke about fibroids in the uterus. We used to call them in residency fireballs in the Eucharist. Okay, so those are benign tumors of the uterus. All of that's more common if you don't eat enough dietary fiber. Okay. The next thing is abdominal pressure syndrome. So normally from the dietary fiber, again, it adds water to the stool. The fiber attracts water, and that makes the stool more bulky. So when a person defecates, it normally should be more like a cow patty or a swirly or something, rather than like a Tootsie Roll or a goat pellet. Okay, somebody who's popping out goat pellets or Tootsie Rolls is going to be constipated. When it's bulky, the stool, what happens is you have like a sense. It's like your butt knows what time it is. Okay, after a long day of work, you get home, your butt knows you're home. Okay, and it's time to defecate. Now, the dangerous situation is you've dressed in layers. It might take you a long time to get all those layers off before you make it to the loo. But the point I'm saying is, once you're ready to sit down and defecate, the bulky stool stretches the internal rectal muscles, and they have this automatic reflex contraction that makes it effortless to defecate when you have a normal fiber diet. Okay? But if the stool's dried out, then it doesn't stretch the rectal wall, and you don't get that natural reflex contraction. So the person strains at the stool. They tighten their abdominal muscles. That's called Valsalva maneuver. And if a person's in the habit of having to do that all the time when they defecate, back pressure is transmitted throughout the abdomen, and this is called abdominal pressure syndrome. Well, first of all, too, they have a tendency to be constipated, and the stool's dried out on the right side of the colon. Normally, the right side of the colon should have wet stool. Okay, when the stool's dried out, it can form a rock in the appendix, an appendical lith. Lith means stone, that obstructs the appendix. The mucus-secreting glands from below continue to secrete mucus, and the appendix can expand and pop. That's appendicitis. Okay, not good. So meat eaters, people who don't eat enough plant foods and fiber, they have much more appendicitis. All right. So now the back pressure transmitted into the sigmoid colon, which is right next to the rectum, that'll cause outpouchings of its wall called diverticulosis. If one of those pops, you leak stool into the belly, that's called diverticulitis. Okay, sometimes it needs to be treated with surgery, sigmoidectomy. All right, the back pressure pushed down to the veins of the rectum, hemorrhoid. Okay, so dilated rectal veins. Back pressure is transmitted down into the scrotum, varicocele. Those little varicoceles are dilated veins. They can heat up the testicles, cause infertility. Translated down into the thigh, that's varicose veins, dilated veins in the legs, and those are not that attractive. Okay, pressure through the inguinal region, increased risk of inguinal hernia around the umbilicus, periumbilical hernia. Pushing on the stomach to push the stomach up into the chest through the diaphragmatic hiatus. So that's called a hiatal hernia as it expands that ring, and more of the stomach pops into the chest, which is associated with loosening of the lower esophageal sphincter such that you get gastroesophageal reflux up into the esophagus. Okay, then there's a very important point I want to make about cancer. The typical way to think of cancer is hot disease, cold disease, cancer. Okay, so what do I mean by hot disease, cold disease, cancer? So the hot disease is acute inflammation due to the gastric reflux in this context right here, gastroesophageal reflux. So you get inflammation of the esophagus. That's reflux esophagitis. The immune system comes in and tries to heal the reflux esophagitis, and then the fibroblast. Initially, it's lots of inflammation, hot disease, swelling, pain, and all that. Then the fibroblasts come in, they're sort of the cleanup crew after an inflammatory response, and they start laying down fibrotic tissue, collagen, fibrous tissue, scar tissue. The scar tissue entraps some normal cells within it. And those cells, they become hypoxic, ischemic. They don't have as much oxygen as they should. And that can switch them over to Warburg-like metabolism, where they switch off their mitochondria, and they primarily run on anaerobic glycolysis. There's a little more to it than that. As a person gets older, they tend to be a little bit immunocompromised, especially if they're sleep deprived, stressed out, drinking way too much caffeine, or debilitated for other reasons and sick. They eat high-fat diets, all of those things. But when the immune system becomes weak and you've got hot disease, cold disease, and you're transitioning into anaerobic metabolism, that cell can get stuck into this anaerobic metabolism and growth pattern. There's actually a little more to it than that. You can have destroyed tissue and immunosuppressed tissue, and fungi can grow into that. Things like Candida albicans and other ones. And those also can contribute to cancer. So what I'm saying is you don't want chronic inflammation, because this is the pattern of chronic inflammation, and it happens in multiple occasions. In the liver, hot disease, meaning like hepatitis or fatty liver, non-alcoholic fatty liver, NAFLD, leading to NASH, non-alcoholic steatohepatitis, and that inflammation then becoming cirrhotic, cirrhosis, fibrosis. That's cold disease. Traps normal tissue in it. That tissue becomes ischemic, colonized by fungi, flipping into Warburg effect, cancer, hepatocellular cancer. Pancreas, acute pancreatitis, acute inflammation. Then that's hot disease, then it becomes cold disease, fibrosed, traps normal cells, fungal infection possibly as well. Warburg effect, cancer. Okay, and this happens all over the place. You ingest asbestos fibers, immune system comes in, tries to clear them out. Hot disease, inflammation, cold disease, fibrosis, ischemic tissue, potential cancer, mesothelioma. Okay, so anyways, what's the point of all that? You want to stay as healthy as you can possibly be, because when you're healthy, your immune system works well, and you're very, very unlikely to get cancer because the immune cells remove it. Okay, all right, that's abdominal pressure syndrome. Now, leaky gut. The normal gut bacteria are maintained by dietary fiber. The good gut bacteria take that dietary fiber, they convert it into butyrate, the most important of the short-chain fatty acids. Butyrate goes to the intestinal lining cells, the epithelial cells, the enterocytes. They use that to make tight junctions. Tight junctions are like this pen is between my fingers. Okay, so none of the bad bacterial stuff can get across the tight junction. If you don't have the fiber, then you're going to get leaky gut, loss of the ability to make those tight junctions. Plus, that short-chain fatty acid butyrate, it travels through the blood up to the brain, and it's used to make the blood-brain barrier. So a person who has leaky gut tends to have blood-brain barrier leakage as well. Not good, bad combination, because that means bad things that come through the gut, increased intestinal permeability, can then affect the brain, cause neuroinflammation. And you can just get inflammation of the gut wall itself, irritable bowel syndrome, for example. You can get the LPS and LTA, bacterial endotoxins. LPS from gram-negative bacterial lipopolysaccharide, LTA from gram-positive bacterial lipoteichoic acid. They go into the blood and they cause amyloid clotting, whereby the fibrinogen cladoprotein changes its secondary protein structure from alpha helix, which is like a cylinder, a slinky, to beta pleated sheet, flat like a deck of playing cards. They now can stack up, form intramolecular hydrogen bonds. The larger the molecular weight, the more likely to precipitate in aqueous solution, which means to clot. So now you got all these little clots in your blood. They're called amyloid clots or fibrinoid clots. Douglas Keller, Theresa Pretorius have written the most papers on these. These little clots travel around your body, plugging things up. That'll cause cognitive decline, contributes to atrial fibrillation, can contribute to congestive heart failure. It's not good. They tend to be 2 to 200 microns in size, okay? So LPS and LTA can do that. Viral infections can do that. And iron overload can do that. We'll talk about iron overload in a minute, but that can be a major contributor to neurodegeneration. Also, because of the leaky gut, you got leaky blood-brain barrier. So now the bacterial endotoxins get contact with the outer surface of the brain. And microglia, brain guard cells, sentinel macrophages, they can bind to that through their pattern recognition receptors, and then they'll release toxic chemicals because they sense it as an invading bacterial infection when they're binding bacterial endotoxins. Okay, and that'll cause collateral damage to the brain tissue. So this is the way leaky gut causes brain damage. You also get big chunks of protein. Normally you can only digest 1, 2, or 3 amino acids together. Okay, but with leaky gut you can absorb big chunks. You need at least 16 amino acids in a row to have a molecule big enough to cause an immune response to it. And then because those proteins coming in from an animal proteins will mimic the sequence of the proteins in our own body. It's called molecular mimicry. The antibodies to that invading protein can cross-react with our own body. That's called molecular mimicry with autoantibody cross-reactivity, and that's the main mechanism of autoimmune disease. Hashimoto's thyroiditis, Graves' thyroiditis, lupus, rheumatoid arthritis, and other autoimmune diseases. Okay, so these are all dietary mechanisms of disease. And the wonderful thing about all this is once you understand it, you realize it's easy to prevent. Just become a low-fat vegan, okay? That's what I do. I have access to every drug, every surgery. I got friends in every medical field. Anything I want in medicine, I could get it. I could get anabolic steroids if I want them. I don't want them, okay, because I'm afraid it'll suppress my intrinsic testosterone production. So I have access to every single thing. I have the ability to read anything. And what do? I'm a low-fat, low-sodium, 100% vegan, organic only, whole foods only, single ingredient only, no added sweets, no alcohol, no tobacco, no marijuana, no substances. I don't take any supplements except methylcobalamin. As far as I could tell, this is the best you can do. So that's why I do it. You know, I'm 63. I don't have any of the chronic Western diseases. I got some old sports injuries, that sort of thing. But I don't have any of the chronic Western diseases, okay? And I want to try to keep it with that way. Okay, I've never had to go for surgery. I hope to never in my life have to go for surgery. I had a cauliflower ear drain from wrestling, but that doesn't really count as surgery. All right, iron overload. The food is all fortified with iron, and the meat's full of iron, the red meat, for example, and that'll cause amyloid clotting. That can cause oxidative stress in your tissues, and that can be associated with cognitive decline. Excessive MSG, monosodium glutamate, manufactured free glutamate, MFG, also aspartame, caffeine, they all cause brain stimulation, like excitotoxin effects, okay, and that can cause anxiety, insomnia, and then excitotoxin, cognitive decline, neuronal damage, okay. The fluoride and the aluminum in tap water are both neurotoxic. They're toxic. They also cause leaky gut. They also cause infertility. Not good. You want to filter your water. It's important to filter your water. And then there's a lot of food and water mitochondrial inhibitors. Fluoride and aluminum are mitochondrial inhibitors. Not to mention, in all the processed food, typically they put some type of mold inhibitor, which is also called a fungal inhibitor. They're usually succinate dehydrogenase enzyme inhibitors, which is complex 2, located both on the inner mitochondrial membrane and part of Krebs cycle. Food dyes are also often mitochondrial toxic. Glyphosate on non-organic food, on 70 of them, including soy, of course, is mitochondrial toxic. So is atrazine sprayed on corn and some other stuff. So is potentially some of these AP, then the letters E and E, L, contaminants potentially. Arsenic, cadmium, excessive fat, especially sat fat, HG, mercury from high fructose corn syrup potentially, BPA from plastic containers, plastic bottles. All of those things are mitochondrial toxic. So you can see that's a lot of stuff that's, can damage your mitochondria. And your mitochondria is the most important thing to keep healthy because that makes your ATP, your energy. And if you drop energy production too severely in your brain cells go into apoptosis, programmed cell death. So you don't want this stuff. It's all bad. Excessive dietary sodium, dissipate your plasma membrane ionic gradients and can lead to hypertension. Okay, you want your K factor at least 5, preferably 10. K factor is the ratio of the dietary potassium to sodium. Whole plant foods naturally have tons of sodium, tons of potassium, intracellular ion, potassium, very little sodium. So if you're a plant eater, you're not going to get hypertension. If you've already got hypertension, they help treat it, but whether or not it goes away completely depends on how much you've lost the Windkessel effect, the elastic fibers in your ascending thoracic aorta, how calcified your arteries are, for example. Okay, excessive dietary fat, and here's the big ones. Causes obesity. Excessive dietary fat is the main cause of insulin resistance, causing diabetes. Excessive dietary fat causes blood sludge, meaning thickened blood. You have a blood pressure to pump blood to the top of your brain against gravity, okay? When the blood is thick, you're pumping a thick fluid, you have to pump at a higher pressure. If you take a lot of sodium too, it vasoconstricts you. Now you're pumping thick blood through a constricted system, pressure goes up. Okay, high pressure damages arterial walls and then that leads to a healing process formed with a clot. A blood clot is what atherosclerosis is. Atherosclerosis is a blood clot. Okay, so anyways, as you get atherosclerosis, you then don't get as much oxygen to your brain cells. That's associated with cognitive decline. Coronary artery disease, CAD. Okay, you can have heart attacks. That can lead to atrial fibrillation. That can lead to congestive heart failure. You'll often see the brain just shrinking from apoptosis, programmed cell death due to lack of energy in the brain cells, and silent little strokes are super common. I see thousands of them every day. Degenerative disc disease of the spine, which is really kind of all the same thing with DISH, interbody fusion, OPLL, ossification of posterior longitudinal ligament, OLF, ossification of ligamentum flavum, and Bostrom disease. I see that stuff all day long, every day. So it's primarily an ischemic phenomenon, as well as damaged collagen due to the influences of things like lack of vitamin C, excess glyphosate, excess caffeine, excess fluoride. The atherosclerosis plugs up the arteries of Johnson's, impotence in the ears, hearing loss, in the eyes, vision loss, decreases immune function, and all these things decrease immune function, decrease blood flow to the tissues, hot disease, cold disease, strong associated with increased risk of cancer. So what I basically just share with you, the most common diseases in the Western world, the vast majority of them are diet related, and toxins in the food. Okay, so this means that it's well worth your time to learn a little bit about this. And I can tell you, like I already told you, I've been studying this many, many years. Low fat, low sodium, 100% vegan, organic only, no added oil, single ingredient foods only, whole foods. That's the best you can do to protect yourself and filter your water. So anyways, hope you found that helpful.